So, a very happy World IVF Day to all of you. Today, I'm going to talk about fertility preservation. As we all know, cancer is on the rise in most countries, and especially when it comes to National Cancer Registry of India, it has already documented a significant rise in past 10 to 20 years. What we have to understand that approximately 30 to 75% of such males and around 40 to 80% of such females, because either directly or indirectly via the treatment of the cancer, they are facing, as a result of chemotherapy, radiation, and surgery, they're facing infertility. Fortunately, around the survival rate has increased dramatically also. So it has been shown that around 70 to 75% of this population, if diagnosed early, are having a good survival rate. So why not make a good fortune out of it, right? So in cancer treatment, the focus has not been just on the cancer treatment itself, but it is also to improve the quality of life. Fertility preservation technique is one such that allows us to preserve the gametes of the patient going through a gonadotoxic treatment. And once these gametes are preserved, an individual or couple can start a family at a time of their choices. As we all know, reproduction is an essence of the life and a right of every individual. Having cancer or such illnesses, long-term illnesses, not even just cancer, right? It compromises fertility by taking away the desire of having that baby. And advances of the knowledge of this disease, newer and safer cytotoxic drugs definitely will improve, but it also gives an opportunity to help these young generation to come up and face, who are already facing a lifetime of despair and sterility. So hence a role of an oncofertilist comes here. Fertility preservation thus brings about a process. It shares you an option for you of either saving or protecting your eggs, your sperms, or the reproductive tissue in toto, so that a person, whenever they want, they can have a biological children. So who are the targeted population? So they are the people with certain diseases or disorders and life events that have affected their fertility. They may benefit from the fertility preservation, especially those who have been exposed via the toxic chemicals, the gonadotoxic drugs, chemotherapy, radiation, have had a long history of endometriosis, the recurrence, and it may harm them or later on cause them an ovarian insufficiency. They're about to get treatment, they have been diagnosed recently for the cancer or certain chronic systemic disorders which may harm, like autoimmune diseases, and they may have to start certain drugs or certain treatment which are gonadotoxic to them, right? And if they want to have a delayed social egg freezing kind of thing, right? Patient also with a family history who are undergoing premature ovarian insufficiency will be one of the targeted population, along with definitely a direct and indirect reproductive organ cancers. So these will be the criteria for them. So what all options do we have for males? It's not just the diagnosis at the prepubertal level, but at postpubertal level we can also do from normal sperm cryopreservation to testicular cryopreservation also. And similarly for the women, we can do, if diagnosed early or later on, we have options from gonadal shielding to oocyte freezing to, if they have a partner, then complete embryo freezing can also be done, right? Ovarian transposition is also one of the tactics that we have. It completely depends on what kind of cancer or what kind of treatment that you're gonna take. So through this topic, I would request all my medical colleagues to know if your patients or your loved ones are about to undergo any terminal illness treatment, and if they have an option of a fertility preservation in hand, please discuss with your oncofertilist, please discuss with an IVF specialist before starting any treatment, because this is how we can help the whole society in complete. Thank you so much.